Hi, I, Dr. Sumit Chakravarty, Senior Consultant, Department of Pediatrics and Neonatology, Head Neonatal Intensive Care Unit at Asian Institute of Medical Sciences, Faridabad, Sector 21. Welcome you all to this video where I am going to enlighten you on tomato fever. The recent media is showing everywhere tomato fever is there. Tomato fever is actually not a new disease. It's been there, just that it has come up as an epidemic this time. It is going in certain states, mostly in the South Indian states. So what is tomato fever? Why is it called tomato fever? Basically, the rash, this is a fever which has rash. The appearance of rash is just like tomato. So the name has been given tomato fever. So it has nothing to do with eating tomatoes or touching tomatoes. Let's be very clear on that. No confusion. It's primarily the appearance of the rash which gives the name to this illness as tomato fever. To the extent some of the doctors have written to the journals, certain journals like Lancet and other journals, not to accept these kind of terminology which can actually confuse the parents and prevent them from giving tomatoes to their kids or to the adults. So tomato fever primarily is because of the appearance of the rash. Now coming to why this tomato fever happens, causes basically. So tomato fever is a mild viral illness. There are certain viruses, which is a group of viruses called Coxsackie virus. A few serotypes of that virus have been isolated, like A6 and A16, which are primarily the cause of this illness. So if a virus enters, if you have touched here and you touch on your mouth, the virus enters your body, and after a certain days, after 2 to 7 days, it can give you fever and with rash, and rarely it can also cause joint pains, diarrhea, vomiting. Rare, that's rare. Now, what are the sites of rash? That is important. कहाँ हो सकता है? Where all it can happen? So it happens in the palm, the soles, oral cavity, gums, cheek, inside of the cheek. So these are the common sites of tomato fever rash. Now sometimes the rash in the mouth can be painful and the child might not eat. So that is the time when we might have to think about giving some IV treatment. If we talk about treatment of this illness, so there is no specific treatment. Fortunately, it is a very mild disease. 99.9% of the kids or adults would recover from it without any treatment. It's a disease which affects mainly children less than 5 years. 1 to 5 year age group is the most commonly affected age group. It's a rare disease in adults, but if an adult has an illness which can cause low immunity, has immunocompromised state like cancer on chemotherapy, like HIV or other immunodeficiency states, then yes, it can cause serious illness. But if we talk of children, it's a very, very mild illness. There is no need to be scared of tomato fever. Let's face it boldly. Let's be ready to take over the phobia from the mind. So coming to treatment, specific treatment, there is no specific treatment. We just give supportive treatment. What do we mean by supportive treatment? If the baby has fever, we'll give medicine for fever like paracetamol, or if the fever is high grade, we might give ibugesic plus. If there is rash and it is itching, you can apply calamine, lactocalamine lotion. If it is painful, you can give oral medicines for pain relief, which again are crocin and ibugesic plus, ibuprofen. Then coming to joint pain, again pain relief medication. Sometimes babies might have vomiting, we give medicine for vomiting in that case. With loose motions, we give medicine for loose motions. ORS and zinc, they are the two most important medicines to be given in any viral diarrhea. So this is also a viral diarrhea, so we give zinc and ORS, that they are the two most important components of treatment of loose motions. Then again, symptomatic treatment and supportive treatment. If sometimes the pain is so much that the baby is unable to eat, fever is high, baby doesn't want to eat, has no taste, has no appetite, then certainly we need to be watchful. We might have to give, rarely we might have to admit the child and give some IV fluids and hydrate the baby. fortunately, it's a very, very mild illness. Very, very rarely, only 1 out of 1,000 kid can have a involvement of the brain, meningitis, which we call CNS involvement, encephalitis. So that is a very rare occurrence. We should not be scared of tomato fever. Let's face it boldly, and let's take out the fear from our mind and live life normally, and teach our kids basic hygiene, that they should wash hands before and after eating anything. After going to the toilet, they should wash their hands. So hand hygiene is something which needs to be taught to the kids to prevent the spread of this illness. So we need to stop the spread of this disease. To stop the spread of this disease, first thing is we should not send the child to school, so that we stop it at a big level. So the child has to be isolated at home for 5 to 7 days, preferably in one room with one adult member of the family, so that this disease is not spread to the other members of the family as well. So isolation primarily and good hand hygiene for 5 to 7 days is all what is required.